Hi, guys. Welcome to the podcast series again. And this is going to be part 4 of evidence based interventions for lymphedema management. To kind of start, I just wanted to talk about just why evidence based interventions is so important, especially when it comes to the profession of occupational therapy. We really pride ourselves in being evidence based practitioners, meaning that a lot of the interventions and the practices that we are, or even the approaches that we are using with our patients, are always going to be backed in research and evidence to support what we're doing to really enhance functional outcomes and improve your quality of life. So, when it comes to lymphedema, there are lots of different strategies and methods and interventions out there, but I really wanted to take the time to go over a few pieces of research that back up some of the more common interventions that we do see for lymphedema. So, we're going to go over aquatic therapy, Pilates, and yoga. To start, I'm going to start with aquatic therapy. There was a scoping review that was done that had a bunch of studies in it that included patients who engaged in anywhere from 30 to 60-minute sessions of water based exercise, specifically for lymphedema. And these sessions ranged from anywhere from 1 to 3 times a week. So the results from this study did indicate that from these lymphatic patients doing aquatic therapy this often, there were improvements in shoulder range flexion, external rotation, abduction, the strength of the limb, their perception of pain, and their overall quality of life. So this just kind of comes to show that aquatic therapy does have some good benefits and positive effects on lymphedema patients. So the next one is going to be Pilates. Um, this one was this piece of research done on Pilates was a randomized clinical trial. There were about 60, or there were a total of 60 participants that were in this study, and sessions were done in groups of 5 to 8 people. And they engaged in Pilates sessions 3 times a week for a total of 8 weeks. And so the results from this study indicated that those in the Pilates exercise group showed reductions in the severity of lymphedema, and they also had improvements in their social appearances, anxiety scale scores, quality of life scores, and upper extremity function scores. So, again, this does prove, well, not necessarily prove, but this does the results do imply that Pilates as a form of exercise for lymphedema can have really positive effects on both physical attributes and psychosocial attributes as well, which is super important. Next, we're going to go over yoga, which was the research done on this was an integrative review that I found, and the studies included any form of yoga intervention in any setting. The results from this piece of research indicated that yoga can be beneficial if combined with an appropriate care routine for lymphedema. Improvements have been shown in this study in physical, professional, and emotional quality of life, and it reduced symptoms such as fatigue, pain, and insomnia. So, all really critical things and very commonly seen things when it comes to lymphedema patients. And so yoga is another great alternative as a intervention. If you would like to um, explore any of these options, I highly encourage you to do so. They are great ways to implement some great exercise routines into your life, and also a great way to manage your lymphatic conditions. Um, so that's all I have for the evidence-based interventions. Pretty quick and easy, just great recommendations all around. If you are interested in the next episode, please go to part 5, and we are going to go over some self-manual lymph drainage techniques. So, if you are in therapy for lymphedema, you might work with your therapist, and they might do some light massage on you to kind of target the major lymph nodes in your body. So there is a way to do this at home on yourself too, to kind of help implement this technique on your own outside of therapy. And so in the next episode, we will go over the different steps to doing self-manual lymph drainage. So if you are interested, please go to the next episode, and I will see you in the next one. Thank you.